This is Mommying While Muslim, recorded live and unedited. Watch as Zeba and Uzma record their podcast, see their reactions, and find out for yourself what all the buzz is about.
This episode of Momming While Muslim is brought to you by Guidance Residential. Sign up for a free webinar on Islamic home finance and the positive impact on society. The link to sign up for the November 1st webinar is in the description.
Okay, this is a lot of running. We're going live.
Then, is your phone ready?
My phone's ready. Oh, no, I need to look at my notes. How am I going to look at my notes and on my phone?
I don't know.
What the heck? I can't
You don't want to, you just want to do this. That's
okay, let's just do this. Okay, oh my God, and I think we're live.
We're totally live. Assalamu alaikum, everyone. This is another episode of Momming
Because
While
we're
Muslim
fighting.
podcast.
We're fighting on air. I'm like, I don't want to do that.
This is Uzma Joffrey.
This is Seba Hassan. And sorry you caught us mid-fight. This is what happens. When Uzma tries to be bossy, and I'm like, I don't want to do this on my phone right now. God, this is annoying.
So yeah. This is just going to be a fun day because Joe's not here to mitigate and referee and fix the techie stuff. So
and he reels us in. Like, so he's always like, oh, stay on topic.
I
stop.
know.
So this is going to be like a free-for-all. But before I get started, I know I've been wanting to do this. I'm going to share my screen. I'm going to share my screen because I have to register for the residential guidance event.
The guidance residential webinar.
Yes, I'm going to do that
right now. You haven't done that yet.
I haven't done that yet. I'm doing it right now. So it's guidanceresidentialpages.com. We will share the link, and it's great because we have it's an exclusive live digital panel discussion about how home finance, the Islamic way, and why it's actually positive for society. Because I don't know about you, that we try not to take on debt. We try to live as debt-free as possible. I know that's not always possible for everybody, but the reality of the situation is we are trying to be more mindful of that. So this will be a very good, should I put in I'm live and putting in all
everybody can. Well, we know you're in Virginia. You're safe. You're in DC Metro. There's no more a secure place to live than that.
Exactly. So I'm signing up.
There you go.
I am registered.
How easy was that? It took like 15 seconds.
2 seconds, everybody. I'm going to stop sharing my screen, but it's Sunday, November 1st, 2020, 12 p.m. Eastern. It's a 1-hour, totally free webinar about kind of financing your home debt-free. So we're super excited to promote that here on Momming While Muslim. And Uzma, tell me about what's going on with your week. How's your week been?
This week has been so fun. As you know, we're doing the book launch, and we put together a montage. There it is. I'm going to get my copy too. Love Meets Life.
So exciting.
Yeah. And if you guys go on the Love Meets Life group or ask to get invited to that, then I think they're doing like 3 book giveaways every day until tomorrow. So every night, I think it's like 5:30 Arizona time, they're giving away 3 books. Tara, who compiled these stories, pretty thick, y'all. And it's a fast read, right?
It's super fast. And quite frankly, I've been I'm a fast reader, but I love, let's just like quick, like each one is like a couple of pages, and I read it like after I do my meditation. I was reading a couple of stories at a time, and I love the fact that there's so many diverse stories in there, voices. And I love that you brought the Indo-Pak culture into it, which, you know, and you're showing a positive of the Indo-Pak culture. Sometimes we talk about the negative. Sometimes we talk about the negative, but there are a lot of positives in the Indo-Pak culture as well. And I love that you introduced that to quote unquote mainstream audiences. So
that's the idea.
make sure you get it. I think we can get it off of our our
It's
website?
on our website. So you go
Yes.
to mommyingwhilemuslim.com, hit the Mommying merch tab, and you can purchase it. And if you purchase it from us, we're going to include some Mommying While Muslim swag if you order until tomorrow, the 17th, because this is book launch week. So we're doing all kinds of special things. And it's only 3 cents more than Amazon. You could order it on Amazon and get it tomorrow, or you can wait until I send you a pretty little package. So.
And we're excited about those pretty little packages.
Yes.
And I'm very happy for you guys. Like,
Thank you.
It's so exciting. I think it's on the Amazon bestseller list within 24 hours. It's now starting to go into like Barnes and Noble. So you've had a really, really amazing week, mashallah. And
alhamdulillah.
That's why we're super excited here at Mommyingwhilemuslim. So I
Thank you.
know you're a great writer. So now the world gets to know that you're a great writer, and so exciting.
Yay. Well, you've been super supportive, but I want to hear about your week. What have you been up to?
Nothing as exciting as, Love Meets Life, for sure. It's just, we're definitely, I think when you first start either virtual school, online school, homeschooling, you're kind of like, kind of excited. But I think we're at that stage right now where what started off as excitement has now started to wear on my older kids a little bit, in the sense that, it's really difficult, not socially. By God's grace, they're pretty good. They still are doing some sports, and they're getting social interaction within their bubbles of friendships. But online learning for my particular kids is very, very difficult. Being in front of the screen for that long just sucks. Like, there's no getting around it. Especially the harder classes that they're forced to be taken, and learning study skills and coping skills, like in class does not translate to out of class, and we're still trying to figure out how to help them with that. So I do feel like that's been a little bit of a challenge in trying to be positive with them, and more understanding has definitely taken the level of patience that I don't know if I have right now.
Prophets, I know.
But we all have to be mindful of, all parents. That's the one thing I want to say. Like, I get it. It sucks. It sucks for us. It sucks for the kids. But this is literally unprecedented time. And I know we live through a pandemic every 100 years, right? But 100 years ago, it wasn't the way that it is now, right? You don't have to do or be expected to do all the things that these poor kids are having to do and be successful. So that's been really hard for me, because as you know, I kind of internalize my kids' feelings and emotions, and it makes me sad. And I cried myself to sleep last night, which I did tell Uzma about this morning. I'm like,
I'm sorry.
so sad. But you know what? Then you have to wake up, put your big girl panties on, and be like, I have to be, put my smile on, fake it till you make it, and just tell them, guys, we've got this. We'll work on an action plan. That's what we do as parents, is to help not solve their problems for them, but to provide them guidance and give them the skill set so that they can solve their own problems. So that is my long-winded way of saying my week sucked. But it's Friday, and I'm trying to be positive about it, because it's Friday. I'm trying to be positive about it because we have a lot of great charitable things that we're doing at Mommyingwhilemuslim, and that gives me hope and provides me, a little bit of reprieve, and that's what we're going to do. But like, did you guys get a chance to watch those crazy dueling? Like, what in the world was that all about?
Yeah, that's going to be our soapbox today.
Okay.
The town halls from last night. So we caught them after they were done. So unlike you, because I think you had to choose which one you were doing, because way weird that they were both like aired at the same exact time. So I don't know, you had to pick a camp.
That's not weird. That was done, intentionally. Let's just be real about that.
But why would you do something like that? Like, I don't understand.
Why do they do half the things they do, Uzma? You're trying to give them some sort of credit that we don't want
undeserved. Yeah, I don't know. So the New York Times has described it as Mr. Rogers versus Blithering Idiot. And so,
So true.
basically it was Mr. Rogers versus I know what you're doing. You're always doing it. That I heard several times from one of the candidates yesterday. Very different feelings in both town halls, and I believe one candidate was answering questions from all different networks and one candidate was not. Guess who? Free
Yes.
press, whatever. It's just a democracy. I mean, who cares about that? But in any case, this still, I believe, was not presidential because I don't know, maybe I'm just a creature of culture and tradition and I believe in presidential debates because that's what I've always known. It still didn't feel very, like there wasn't that.
Presidential.
Well, it wasn't that, exchange and that debate, the actual, seeing two different views and opposing views. I think that's really important and that's key to our democracy and that kind of civil discourse, but we weren't able to see it. And on one of them, it really wasn't very civil, very aggressive. And I think it was in order to balance the very aggressive questioning that particular candidate had. And I was very happy and was like, man, why wasn't she moderating?
She was really good. I
She
do
was
have
really
to say.
good, hitting hard. But I know I really appreciated that she had to psychologically shut down and move on when there was a non-answer. And there were several non-answers. So in terms of, did you endanger your opposition at the debates when you knew you were COVID positive and you still showed up? Completely evaded the question. No straight answers. We know what the doctors have said. The wonderful doctors on his team have already accidentally said he was positive on Tuesday, but he still showed up on Thursday. So we already know that because apparently I can't stay in a fancy house, just apparently in my fancy hotels that smell really tacky, by the way, because they put the Trump cologne into the air vents. I unfortunately did stay in one of those. Very disgusting, bad allergies. Completely skirted the tax question. Promised a peaceful transition.
Yes.
So that made me happy. And actually his answer on the appointment of the Supreme Court
Yes. I like
justices
that one.
was a good answer. And
It
I was
was a
like,
good
do you have an
answer.
earpiece in there? Is somebody
Yeah.
feeding you that? Because that's actually really, really good. I appreciated that. But all I heard was Antifa left, Antifa left, Antifa left, law and order, blah, blah, blah. And it was like,
And QAnon, what the hell is this? Why am I just, I'm like, have I been living under a rock or what was that all about?
QAnon is like this news source and
Okay.
group of certain supporters who believe that the left has this what is it called, deep undercover agenda for pedophilia. Like they really believe that Democrats are pedophiles
Okay.
and that Trump has been ordained by God to save our
Oh,
children from pedophilia. And I'm
okay.
like, of all the people to save our children from pedophilia, the best friend of Jeffrey Epstein is probably not the person who's going to save our
Oh
kids, right?
my God.
I don't know but what the hell do I know? I don't know. So they're conspiracy theorists, and he suddenly doesn't know who they are. And you can go back and you can find evidence of, him completely spewing exactly their information. Now, is it a speechwriters that are cutting and pasting? Possibly. Who knows? But man, they need fired. I think what was most memorable was my barf moment when, so people were asking questions, really
I
good questions.
totally know what you're gonna
Oh
say.
my
Oh my
God, I
God.
barfed. I had to stop what I was doing and just walk away because I just want you to know that you have such a beautiful
Oh
smile and
my
you're
God,
so
I
handsome.
knew you were
I
gonna
mean, can
say
you pick
that.
your tongue up off his boots? Like, we don't need to do that to anybody. I don't care if it's president. I don't care if it's the Pope. I do not care. Like, you do not wipe your tongue all over the floor in front of a man. Shame on you. Like, it made all women everywhere look
I
bad, and I'm ticked.
and I was so cringing. But in fairness, I've never seen him actually smile, and I did see him smile, and I was like, okay, I could see what you're doing. But I just thought, with the orange tan and the sweat and then the hair, he's probably not my example of, a handsome gentleman, but we should not be choosing our
I guess I shouldn't
presidents.
judge that. Yeah.
Okay, we should not be choosing the presidential candidate based on, how he looks, because that is not right.
Yes. No. And so here's the thing. No healthcare agenda. I'm going to
Nothing.
cut down Obamacare is what he calls it. I'm going to get rid of it and dismantle it, but I have no backup plan.
Yeah.
I'm going to cut all these taxes, but I have no plan for all these other programs that were started post World War II when our population was low and our people needed stuff. And now in a pandemic where it's getting really close. It'll be, I think, by the end of the year, 1 million women out of work by the end of the year. I mean, this is a huge economic downturn, and the economy is not based on stock
And why
numbers.
is that? A lot of us had to quit our jobs
Exactly.
to help with the kids and the schooling right now.
Exactly. So, we should be judging people on platforms, but when they're not side by side on the platforms and when they're broadcast at the same time, I think it's a big disservice to the American community that needs to have the issues and needs to have access to be able to go back later and listen to the other side. And I do think it is important. And I do want to just mention really quickly, kind of ending on my vomit moment, I would have had that vomit moment if a woman had got up on the other broadcast and said it to the other candidate as well. Don't you tell them that they're handsome, because that doesn't matter. Again, like you said, smart, have issues, have a plan. Don't just walk in and say, oh, well, he didn't, have a COVID plan. He wasn't the president. He's not the president, so it's not really his job to have a plan for the pandemic. It's yours. And almost 300,000 people, Americans, are dead now because you didn't have a plan, and so my soapbox is, again, kind of going back to our soapbox from last week, civil discourse is really important. Know the issues. Make sure you vote based on issues, not on hair pieces.
Let me ask you this. Okay,
Yeah.
so we were, and this is the first time we haven't had a guest on in a long time. So it's kind of nice to be able to chit chat amongst ourselves, and we'll get into the topic in a little bit. But I've heard a lot of pushback from the Biden about the Biden campaign as well, that it was his moderator was a little bit more soft pedaling on the issues and didn't necessarily talk, so how can we get an accurate comparison, really?
Right.
Which is almost a stupid thing for Trump to have done, because quite frankly, they would have seen the comparison of the two different types of questions, right?
Yeah,
so
absolutely.
Biden's questions were softer. They kind of skirted around some issues, around his son specifically, and his rambling, and and honestly, he does have a handicap in the sense that he does stutter, and so sometimes rambling is a symptom of that. So I don't want to downplay that at all, but his line of questioning was different and was softer. So I do want to play, the devil's advocate where that's concerned. Obviously, I've already voted, spent 2 hours in line to vote.
I felt so bad for you.
But it was
30 seconds to vote.
Oh my God. But it randomly met one of my friends there. So that was nice. And of course, we were standing in front of a 97-year-old nun, which I thought, except in that she voted, I was helping her the entire 2 hours with her chair, and she's voting for Trump. So that's okay.
Well, I guess that makes sense.
I was like, that's okay. Everybody has a right to who they want to vote for. We love you anyway, and I'm still going to help you. But I know we are continuing our our topics for the week, and I'm laughing.
Why?
Because I can't even pronounce one of the words in our topic. And I'm just going to say
We
that
will fix it.
we will fix it. You're going to teach me how to do it. And I
Yes.
have somebody texting me right now, like, what in the world is this topic you guys are going to be talking about right now? But okay, we're all women of a certain age. We have to be mindful of this, and this is continuing Women Health Month in our Women Health series. And, we're going to talk about hot flashes, the good, the bad, the ugly. And okay, atrophic vaginitis.
You
I'm
did
even
it.
scared. I did it, but I'm
You
scared
totally
to
did it.
look it up in Google because I don't know what's going to show up. So
Please don't
why
Google.
I'm
Don't
not going to
Google it.
Google it. So
Yeah.
you tell me, Uzma, like school me. I can help you out with the hot flashes. But let's start off with the atrophic vaginitis because I am myself curious about what this is.
Okay, well, I'm glad you're asking. And I just want to qualify myself a little bit because I'm not pulling any of this out of my butt. I'm board certified in family and geriatric medicine. I deal with this almost daily, definitely weekly when I see my patients because when you're a geriatrician, you're seeing people who are older than 65. The majority of my patients are women. And so this is a complaint that we get from the younger old, the middle old, the oldest old. Everybody has it. And then on top of it, a lot of young women also have these complaints. And so sometimes they'll call me and we'll talk about it. And,
Does it mean that your vagina is starting to go away?
Atrophy, yeah, that's
Okay.
what we're going to come to some definitions because when you
I'm
hear
thinking of my
atrophy, you're
Latin
like, oh my
words.
God, it's going to wither away. Yeah,
What
well,
does it become? I'm
yeah,
curious
what
about
happens to
that.
it? Does it turn into a raisin? Not really. So, okay,
I'm
let's
already
talk
there,
hot
girl. I'm
flashes.
already there. Oh
No, you're
my.
not there. Hot flashes are known in medical literature as vasomotor symptoms, and the reason for that is because it's based on the flexion and contraction of your blood vessels, which are smooth muscles. So it's vessel, and then
Mhm.
motor, it's movement, vasomotor symptoms. So if you ever read that in medical literature, they're talking about hot flashes. So it's like the only word in like women's health that men didn't make completely misogynistic. So
Okay.
you guys know like hysterectomy is based on hysteria, right?
Hysteria.
Because women are hysterical. Yeah, it's really annoying. That's a digression. So we're not going to talk about that. But atrophic vaginitis used to indicate the inflammatory changes that happen in the vaginal walls as we age, or even during pregnancy, this happens.
Hmm.
And so now, since I believe 2014, consensus has changed that term. It is now known as genital urinary syndrome of menopause.
Hmm.
And again, it used to mean just the changes of your vaginal walls and canal, but now it includes vaginal burning and itching,
Ooh.
decreased lubrication during sex that makes it very painful or sometimes causes you to bleed, and then frequent vaginal or urinary tract infections or frequent urination. So this whole symptom spectrum comprises genitourinary syndrome of menopause, because it's not just your vagina that's affected during menopause and this imbalance of hormones, right? It's also, remember, we talked with was it Dr. Tayyiba like 2
Yes.
weeks ago when she came to talk to us about endometriosis, and I revealed that I hadn't even, oh no, it was during our Wednesday wellness when we talked to at-home pelvic therapy. And
Yes.
Selma, what I told her, I didn't even know where the 3 holes were exactly until I went to medical school. So when your lubrication changes down there, I hate saying that, I'm sorry, but it doesn't just affect your vaginal wall, it also affects your urethra, the
Mm-hmm.
orifice or the hole through which we pee. And so when there's not
Everybody,
lubrication there, go ahead.
that's a different hole.
It's totally different hole, guys.
Just so
Okay.
people know.
Yes, yes, absolutely. Completely different hole. And let your daughters know that too, okay? Because I grew up a very confused child and very scared all the time. So when you don't have appropriate lubrication, your natural bacteria that lives on your body and is protective over there is going to die out. It actually changes the pH. And so
Hmm.
it used to be pH balance douche and pH balance vaginal wash and pH balance this, that. Please don't buy into any of that crap, because unless you actually have pH paper and are testing the pH of your vagina all of that stuff is garbage. Plus it's all scented. It has unnatural products that can actually worsen the dryness you're already having in your vagina. Dryness in your vaginas is going to cause more urinary tract infections. Again, going back to getting rid of the natural bacteria that you have over there. It's going to cause the pain because there's friction when you have sex or when you have any kind of manipulation down there. And that can also cause more urinary tract infections. And then of course, when you don't have nice, swollen, red, the vaginal walls are actually really wrinkled and red because you know that the glands down there are like secreting all of that stuff that we look at as so offensive, but it is actually protective and natural and supposed to be there for our vaginal health. But what tends to happen is all of those wrinkles go away and then the walls of the vagina pale. I'm hand talking right now. I know it looks really weird. Sorry.
Like somebody else that I
Like
know.
somebody else I know. Sorry. But at least I'm not doing it like this. The most excellent vaginal walls get thinned out.
Okay.
And so with friction and manipulation, when you stretch like a rubber band, you're going to tear it in places. And that's where we notice bleeding.
Okay, so let me ask you this. Since we're talking about that, is there such a thing, like I'm just
You're
gonna
hand
be
talking
honest.
now too.
No, I always hand talk though, let's be real. But can you get rejuvenated down there? Like they have these rejuvenation.
Rejuvenation, yeah.
Like, so what and how does that happen? And then we'll talk about why in the world does this happen to us? But can you get vaginally rejuvenated?
So vaginal
FYI?
rejuvenation, it depends on what it is because I can't speak to the vaginal rejuvenation that's supposed to be more natural, quote unquote, where you're flushing stuff in and trying to flush stuff out. That just sounds to me like glorified douching, which is not recommended by anybody. Please don't douche, okay? It doesn't do anything except, again, flush out your natural bacteria. You don't want to do that. Now,
don't douche and don't be a douche.
Exactly, both.
Two things.
Touche, absolutely. But vaginal rejuvenation can also be surgical, and this can be necessary if you've lost a lot of weight, and so you have excess skin folds now. Your labia are basically hanging, and it can impede like what you're wearing. It can impede your hygiene. It can impede sex sometimes, you know? So pulling that stuff tighter and making it look younger, more tight and less elastic. Like, let me just tell you, part of natural aging is going to be that we're going to start sagging down there because we will lose body fat everywhere. And of course, we know that we're going to lose body fat like in our boobs, our butts, and everywhere else that matters first before we start losing it, like, you know, in our thighs and the places we actually care about. And so the vagina, the vaginal, the lips, which is the labia, can be one place where that happens. So it's a surgical tightening of our, I guess, lip injections or Botox of the vaginal lips.
Ooh, lip injections.
And I'm not against that. You know, if you're just trying to pretty it, like, okay, you know, it really does make a difference for some people. More power
but there's no actual medical need.
No medical, it's more cosmetic.
That's what I just wanted to know, because you know we've had 4 kids each, so
yes, there was a time when I thought about it because I was like, holy crap, is this ever gonna like go back to normal? And
but it does.
About 2 years once I stopped breastfeeding.
And it does go back to normal. So why does this happen to us? Like, it does suck in the sense that, like, I have to say, I haven't, by God's grace, not yet. When it happens, I will tell everybody, but I have not experienced any of the hot flashes because my default temperature is hot because I have thyroid issues, but that's a whole nother topic. But why does this happen? Is it hormonal, like a lot of people think, or what exactly is going on? All I remember is when my mom was going through it and she's going to be mortified, she'd start sweating and turning red and getting really angry at us, and we'd like slowly back out of the room. And I fully expect that that's going to happen to me. So I am not trying to minimize that, but why medically does that actually happen to us?
So hot flashes are characterized by exactly what you described, what our moms have told us. They get intensely hot, sometimes in the face, sometimes just near or around their vagina, sometimes all over their body. It can
Ooh.
be characterized with sweating, it can be characterized with anxiety, sudden mood change, but it's more like real sudden irritability. And unfortunately, it can last all through menopause. It could be just for a brief period before menopause or around it, or it can be until you go to your grave.
Ooh,
So, and
no.
that's really, really hard for patients when they're complaining about that. It's like, oh my God, I've been menopausal for so long. Why the hell is this happening? And the definitions I failed to mention earlier is that menopause is the absence of a period for 12 consecutive months.
Okay.
So
So
no period for 12
yeah.
months.
So you can't like have a couple of periods and then you
Nope.
lose a couple of periods, or
You're
you know,
just a regular or
okay.
perimenopausal, depending on your age at that point, but you're not in menopause until you've been a full year without a period.
Got it.
Okay. And not just a weird period like your normal periods.
Okay.
And so why does this happen? It's because Jenna don't come easy under our feet, baby girl. But to simplify why all of these horrible things happen to us is I'm going to
Okay,
talk.
first of all, let's change the vernacular.
Okay.
We're not going to say horrible.
Oh,
We're going to
natural
say
changes that happen to women.
unfortunate natural changes that may occur. We're going to change the paradigm and we're going to take that back.
Because Zara Al-Jabri taught us to mindset shift yesterday
Yes.
on our
And
episode drop. So yes,
yes.
listen to that if you need to.
So we are
I will
changing our
re-listen
mindset.
actually. Yeah. So the easiest way that I can describe this is two hormones, and that's estrogen and progesterone, which most of us are familiar with. But just know that there are thousands of hormones at work in your body. So nothing makes me, not even presidential town halls, make me want to slap people harder than when they show up and say, test my hormones. Yo, shut up. Like, you got like 1,000 hormones. Tell me which
Yeah.
hormones you want to test, you know?
And specifically for this, it's progesterone and estrogen.
No, there's actually more at play if we're trying to figure out if you are in menopause or if you have like what's called premature ovarian failure, which means younger women who are blasted fast forwarded into menopause because something happened to their ovaries. So there's more stuff involved, but just for our purposes today, I'm going to simplify it to estrogen and progesterone. So when we're, you know, younger and we're having our periods and we're pregnant, it's the estrogen and progesterone cycles that are building up or letting go of our uterine lining. That's what our period is, right? The blood is actually the lining of the uterus trying to prepare for a pregnancy. So the state of pregnancy is when our estrogen is really low and progesterone is high to keep the baby in there. That's why we notice when we're pregnant, progesterone is higher, like the balance is higher. We have good hair. Some people are lucky to grow it on their head. The unlucky ones grow it on the rest of their bodies.
Yes.
You know, their lining of the uterus stays nice and thick, again, to support that placenta and that baby. But then, interestingly, you might notice when you're pregnant is that sex hurts. And why is that? It's because you don't have that estrogen that's stimulating your vaginal walls and glands in your vagina to secrete the secrete the stuff that you need to keep
In
it
order to be lubricated.
moisturized, keep pain, sex from not being painful. And so those are some of the changes that you might notice. I do want to mention that up to 50% of women are suffering from postmenopausal symptoms of hot flashes and atrophic vaginitis, but they don't report them. 40% of them, the symptoms that they have, so almost a majority of the symptoms that they have are these two things, hot flashes and vaginal complaints. We're not going to call it atrophic vaginitis because, again, the genitourinary syndrome of menopause includes so much more than just your vagina. It's also your urination. And then another thing to note is that menopause can start as early as your 40s, but the average age in the United States is 51.
Okay.
So
we have a little bit of time.
I think so. There is a genetic component. Like your
Okay.
doctors will always ask you, like, when did your mom or your maternal aunts, paternal aunts go through the change? If they say the change doctors because they're pretty old school.
Okay.
Um,
I was going to say, I don't think I've ever heard of
yeah.
that in a long
My
time.
patients say it a lot because my average patient
Oh.
age is like 87. So they're like, oh, when I went through the change, and I'm like, it took me a while to pick up on that. I was like, what? Menopause, you mean? Oh, yes, menopause. But yeah, it can start in your 40s with period irregularity, with
Okay.
changes in your sensations or experiences
Okay.
when you're having sex. So
So
those are.
that's actually good to know. But this is my question to you.
Mhm.
Okay. Menopause also brings about another factor in a woman's life, the
Okay.
inability to have any other children.
Yes.
Right. When we start that, when we start thinking about it.
Mhm.
And have you ever thought about going through that and feeling like, oh my God, I should have more babies? Like, is that a thing where people start thinking, oh my God, I need to have more children right before they hit menopause? Or what have you seen from people of that age going through something similar? Like the concept of I can never have children again.
I have had one person who was a personal friend tell her husband that she was in menopause
Oh, and she was pregnant.
just so she could get pregnant. Uh,
What?
Everybody else our age is like hell to the no,
Oh,
and I am of that camp where I can't wait to menopause till menopause
oh.
because I don't want to be fearful of getting pregnant.
We told you how to fix that.
I know we've talked about it, but like
Okay.
I'm just not good on the contraception thing. That's why I have four.
Back to back. But there's other ways, like getting fixed,
Yes,
that we
yes,
could do
yes.
if you don't want to do that. But
I'm not getting fixed. I already paid my time.
I know that's exactly what happened to us. But that having been said, like, so this is my issue. Like, obviously, I have thyroid issues, so like I'm always a little bit, so it's always, my hormones are always already wonky. Okay.
Right.
And I'm, a pretty much of empath in the sense that I am in control of I feel very big and I am in control of how I feel.
Okay.
I'm so fearful of when I actually go through this change.
Hmm.
Am I going to grow another head and become like a crazy banshee, literally? Like, what can I do proactively, knowing how emotional I am when I'm quote unquote normal, that how I'm going to be when I go through that? Like, I need to start being proactive with the way that I handle things, or develop some sort of coping mechanisms or something, or maybe hormone therapy. I keep hearing and reading about hormone therapy.
Hmm. Well, hormone therapy is typically going to be held off until you actually hit menopause. So I
Okay.
know few doctors who would hit you with hormone therapy as prevention of the symptoms. Like you wouldn't do them before you hit menopause because you don't know what your symptomatology is going to be until it actually happens.
Right.
So preemptively, what can you do? Maximize your health right now by eating
Yes.
right, exercising right, mindset framing and
Mm-hmm.
reframing, doing the therapy, taking the medication for our chronic conditions. That's really important. All right. So your annual well check is going to be key, key, key. All right.
Okay.
Super duper important. That's all you can do. And then once you hit menopause, yeah, that year is going to suck, until you're officially menopausal. It may potentially suck, but you're still going to check in with your doctor once or twice that year and you're going to say, I'm experiencing this. This is what I think it is. Your doctor is going to say, thank you very much. Here's a pat on the head. Come back when you're officially
Okay.
menopausal in 12 months. Don't go in there asking for a hormone check unless you have something like thyroid, where you're going to need your thyroid hormones checked potentially every 3 months
Yeah.
or even more frequently, depending on how off or whack you are. And menopause can, do a number on your thyroid during that time. So, and there's plenty of other conditions like diabetes that you have to be concerned about, all different hormone dependent. So once you hit menopause, there's a bunch of stuff that you can do. Now, gold standard used to be when women hit menopause, doctors would give them estrogen. A lot of that was because estrogen not just doesn't just give you good period health and good vaginal health, it also protects your bones and your heart. It's cardioprotective, and we know that the number one killer of women is not cancer. It's definitely not your vagina being off kilter. It's heart disease. And so that's why women actually used to die less than men back in the 50s, because they were still cardioprotected
Oh.
by their estrogen. Now, what they found out is when you give women estrogen uncut like that, they're going to get more breast cancer. So that's
Oh.
an issue. But there was a women's health initiative, which is the largest women's health study that's been performed in America since 2001. And so they followed women for 13 years. And this is an ongoing study. So it's a longitudinal study. So they're still finding out a lot of information from here. But they found out that after 13 years, if you do a combination of estrogen and progesterone, not the same combination that you would use in your birth control pill, way
Okay.
lower doses, way lower doses. If you use those, you will still increase a woman's breast cancer risk and blood clots. That's kind of bad. But you reduce her hip fractures, which is, also a
Kind of good.
cause of morbidity and mortality in the elderly or older women, more mature women. But there's no evidence right now that low dose estrogen increases your breast cancer rate or the recurrence of breast cancer. So a lot of women, like I know when I was first training, we didn't give hormone therapy to anybody who had had breast cancer. It just didn't matter. You didn't do it at that time, but that practice
Okay.
has now evolved because, of course, I trained a while ago. So we have more information now. Hormone therapy is really the only thing that's guaranteed to control your hot flashes and your vaginal complaints. But again, you have to decide, what do you want to do? Like if you have a strong breast cancer history, if you have a uterine cancer history or at risk for that, then you have to worry about these things. So it's not just once you're worrying about the vagina, then you also have to worry about the breast, and then you have to worry about the uterus. It's all kind of connected. And then add bones and heart to it, you have more things to think about. So there's something that I wanted to share. The Women's Health Initiative showed that women who had been on the hormone therapy and had these menopausal complaints taken care of, you take away their hormone therapy, 56% got them right back. And, like I said, these hot flashes can be with you to the grave. And sometimes they can be so debilitating. Women have had to quit work. They've had to quit socializing. It's messed up relationships because, there's the whole situation of also andropause, which is outside the scope of today's talk, but it's right when we're going through menopause, our partners may be going through andropause. And because I'm not a men's health expert, I'm not going to speak to it. But that's like a big deal. So the American College of Obstetrics and Gynecology actually says don't pull hormone therapy from somebody who's been taking it unless you discuss with them, like, here are the risks versus benefits in your case, and let patients decide what risks they're willing to accept and, what they want their quality of life to look like. That's super duper important.
So where can people find out more? Like, do you have any sites or anything like where people can look this up to get accurate information before they visit their doctor?
Well, yeah, there are actually patient handouts on the aafp.org, which is the American Academy of Family Practice. And that's where I get, I rely on that for my education because, that's where I'm board certified. So it's important to me, but you can also go to the American College of Obstetrics and Gynecology, ACOG, and look them up and look for patient handouts on postmenopausal symptoms. And so they do a good job of also talking about natural versus medical treatment. So do you want to talk a little bit about treatments before we send people looking there?
Well, what are the treatments? I mean, because quite frankly, it sounds to me that we're damned. We're going to pick our poison.
No.
Like, I'm going to get this and I'm going to be like, it's either I'm getting I'm going to die from one kind of cancer
No. So here's the good part about it. Like with the hot flashes, yeah, you can go hormone therapy. But again, when I was training, we were way more conservative with it. And I'm still super conservative with it. Why? Because I treat the oldest old, right? So the women in my category no longer are getting mammograms. They're no longer getting pap smears. So I don't know if giving them a hormone is then going to cause them a cancer. And really, even if it did, it's probably not going to be the reason they die, because they've got
Okay.
all kinds of other organs that are messed up too. So those will kill them first. But for our moms, all right, my mom has a history of breast cancer, and public service announcement from her, which she was like, you better start making this on all of your episodes now. Get your screening mammograms over the age of 50, over the age of 40. If you have a strong family history of breast cancer, discuss your risks versus benefits for your doctors. She, alhamdulillah, is a survivor. So for somebody like her, she's still going to listen to her old school training, because she heard after menopause, it's going to increase,
Your
hormone therapy may
chances.
potentially increase your risk of breast cancer or uterine cancer. So sometimes you've been menopausal for like, say, a year, 2 years, 3 years, you've decided to do hormone therapy because the hot flashes are really bad and you keep getting urinary tract infections because your vagina is so dry. So you decide to
Doesn't
do it.
sound good.
You may notice that you'll have some bleeding after sex, or even just after your normal hygiene. And
Are we
that's,
still having sex then? Like,
yes, you are. You're
oh
not dead.
man.
If you're not dead, you're still having sex.
I'm
Okay.
like, at that point, are we still having
Yes, you
sex?
are.
Really?
That was actually my project in fellowship when I did geriatrics,
To have
was
sex?
sex and intimacy in the oldest people. And guess what? 70 to 79-year-olds, 3 times a week, penetrative sex.
Oh, what are you talking about? I keep reading these stories about how like STDs are like rampant in
Yeah.
nursing homes.
My
I'm
nursing homes
like,
are
you
brothels.
see me
Everybody sleeps with everybody else.
turning red. I'm like, I don't want to know if
Hmm.
grandma is doing that with
I
somebody
promise you,
across the
grandma's doing
hall.
it. She's doing
Oh
it.
my
We're going to
God.
be doing it as grandmas too. So that's why it's really important to know this. So in the conservative field, what we used to do is there's a lot of antidepressants and even some medication that's used to treat like nerve pain or even seizures
Okay.
that can be used very effectively in my experience, because I've been doing it for so long now. We can control the hot flashes really well. And then the women that don't want to use like topical estrogen to lubricate their vagina, they will just use over-the-counter water or silicone-based lubricants, and that can help with any pain on sex that they're having or any vaginal dryness they're having. And if you've had 3 UTIs back to back to back, I'm going to recommend to you, like, I'm actually okay with petroleum-based stuff too, so I'll recommend KYs, and even Vaseline. For the ladies who are like, I don't want to insert anything. We have hormone rings that we can also insert into the vagina for up to 3 months. And so
Ooh.
that provides lubrication down there. And when you localize the hormones to like one spot, it actually doesn't increase your risk of either breast or uterine cancer. Now, I will say, if you've been menopausal and this is another public service announcement, if you have any bleeding, or if you hear your moms or your aunts or your grandma saying, I have bleeding, like I don't have wudu anymore, I can't pray, this is so weird, I stopped having kids. In 5 to up to 10% of cases, that's a sign of uterine cancer. So
Ooh.
you really want to get grandma, you really want to get mom into the doctors immediately, get an ultrasound, see if that uterine lining is thick. It should not be. Once you're menopausal, your uterus has no business getting
Thin.
thick again. If it is, you got to go into that lining and do a biopsy and make sure there's no cancer there. This has happened to me at least 2 occasions where relatives have suddenly complained, Beta, daughter, I don't know why this is happening to me. I haven't had a period in like 10 years, but now I'm like spotting or bleeding. And it's like, okay, go to the doctor. Sure as sugar, it's cancer. So in my days of training, if you had a postmenopausal woman with any kind of vaginal bleeding, it was cancer until proven otherwise. So I will say, it's really important to talk to your doctors about these things. Remember, 50% of women are suffering in silence, and that's just way too many. One woman is too many. I will say there is a new medication that I'm not familiar with, and it is an estrogen-based therapy, but they're calling it non-hormonal, and it's first line to treat the genitourinary syndrome of menopause. I haven't used it, so I can't speak to it. I have recommended natural stuff, black cohosh oil, to women back in the day, but studies have not shown it to be effective at all. So it's not something that I recommend anymore. The only thing I would say is the antidepressants for the hot flashes and the vaginal lubrication as first line if you're having those issues. And if you continue to have issues after that, then you need to talk about next steps with your doctor.
Well, it sounds like it's more symptom management, right? Like
it is. It really is.
You're not getting rid of
it. Quality of life, right?
Right. And it's not getting rid of it. You're going through the process. You're going through the change. But these are symptom, if you can't handle it, these are symptom management techniques that you can use. Talk to your doctor. Obviously, this is a great stepping stone for you to get some information, see if you have any of the red flags. Yeah. If you do, go to your doctor. That's what we always recommend you doing. And we can, if you need help in trying to figure out what doctors to go to, I think it's the not OB, it's the gynecology at some point, right?
Well, no, you can still, a family practitioner can do all of this. So as a family practitioner, I used to do endometrial biopsies. I used to order the ultrasounds and say, okay, like once I diagnose the cancer, then I would send them to the obstetrician, the gynecologist, because that's who's going to do the surgery, right? Because usually it's going to be surgery, chemo, radiation, or some combination of that if you have any kind of cancer of the uterus or cervix. So, any questions? I don't see any questions on Facebook.
That's because people are overwhelmed, girl. I mean,
I'm sorry. Was that too much information, y'all?
No, it's not too much information, but I do know it's around the corner. You know, we have a decade or so, hopefully, inshallah, before we get there. But in the meantime, it sounds like try to be healthy, do your annual visits. If you have any kind of risk factors, go ahead and, get the mammograms done, get all of those types of studies done, because the reality of the situation as moms, we are the heart and the center of the home, and taking care of ourselves is priority before we can start taking care of our family. And trust me, this year I've learned that the hard way, and I definitely recommend go see your doctor. But thank you, Uzma, for, of course, always enlightening me on the beauty of atrophic vaginitis and hot flashes and all the things that are coming. What do we have? What do we have in store for next week?
Next week, we are talking about pregnancy and preventive care. And that's going to sort of round out Women's Health Month. And then October is a bonus month because we have a bonus Friday. So we'll be doing our last live stream on a very controversial topic. Do you want to reveal it right now? I mean, our schedule is going to go up. People are going to see it anyway.
Well, we can
if you're on Instagram, you'll see our schedule.
Yeah, you can tease it out a little bit for the people that are not like me on Instagram.
For anybody who's on the edge of their seat watching the Supreme Court Justice nomination, or if anybody can figure out why Zeba's new friend, the nun, voted for Trump. That's what we're talking about on October 30th.
It's always fun times here at Mommyingwhilemuslim. So thank you everybody for joining us today.
Assalamu alaikum, everybody.
Assalamu alaikum.